Yes, hello, Sanbonani. Good morning, everybody. Today is the 8th of May, 2021. And again, welcome to the show, Dr. Nhlakanipho, Gumede Talks Health and Healthcare Systems. I'm with my co-host, Dr. Sanele Mandela. Today, we are going to be looking at a topic about coronavirus as an infection and the pandemic that is actually overwhelming South Africa, but also the rest of the world. We know that we've been struggling and we've come a long way from 2020 until today. We are still battling with this infectious disease. Today, I thought that it was important for us to look at some of the fundamentals and to share some information around the issues of COVID-19. So we're gonna sort of like exchange these words. It's COVID-19, coronavirus, and you should know what we're talking about and that we're talking about particularly the same thing. So good morning, everybody, and welcome to the show. Dr. Mandela, can you please greet our viewers?
Good morning, my brother, Dr. Gumede, and good morning to all our viewers and listeners all over. Yes, it's the 8th today and Saturday morning in South Africa. So we hope that we will discuss and talk about COVID-19, coronavirus, and see what information that we can share with our viewers, and also to hear some few questions that we can maybe tackle, and hope that we are doing very well in South Africa, and we are managing our issues in a nice way. Okay. Thank you very much, Dr. Gumede. If maybe we can, Dr. Gumede, start by maybe just updating our statistics today, how we look like in South Africa in terms of COVID-19.
All right, thank you. Let's just look at our statistics. I mean, you know that every day we've got statistics that are being sent and there's a cutoff time. So statistics that we'll be sharing today are actually statistics that are from the 7th of May, that is from yesterday. Today's statistics obviously will be ready again tomorrow, but it is important for me to also highlight that some of the stats that we're actually reading are from a website that you can actually access, and that website is sacoronavirus.co.za. If you go into that website and you go to news and updates, you will get statistics of every single day on how is the behavior of COVID-19 in South Africa. There are also statements made by our health minister, Dr. Zweli Mkhize, who actually all the time tries by all means to talk to us about some of the new developments when it comes to COVID-19 and the vaccines. So from the 7th of May, obviously today, that is yesterday, we had an accumulative number of COVID-19 cases that were identified in Southern Africa, totaling to about 1,592,626. Allow me, Dr. Mandela, to actually give you these statistics per province as well. I mean, looking at which provinces are actually having more cases than others, and there could be many reasons for such. But just to start one, Eastern Cape has actually a total cases of about 196,228. That actually is estimated to be at about 12.3%, while at the same time, Gauteng is actually sitting at 427,133. That is actually a leading province with the majority of the cases that have been diagnosed with COVID-19 at 26.8%. KwaZulu-Natal, on the other hand, is actually sitting at about 337,130, which makes them to be at 21.2%. And then on the other hand, we've got Western Cape, which is sitting at about 287,795. That is actually putting them at about 18.1%. I would like to go through all of them, but because of time, I think those provinces right there, I thought that there were provinces that I need to highlight when it comes to this. Also, it is important for us, Dr. Mandela, to look at in terms of where are we testing our people. And it is estimated that probably we've actually tested the number of tests that has been conducted are totaling close to about 11 million. To be precise, there are 10,831,738. And obviously, out of those cases, we've got private sector as well as the public sector, and more of the tests have been done in the private sector than they were done in the public sector. And the private sector is estimated to have already tested about 56% of all the cases that have been tested for COVID-19. Now, when we go deeper again and look at the deaths and recoveries of which I think this is one particular statistic that is very, very, very important for us to note, is that to date, we have about 54,687 deaths that have been reported. And obviously, you'll be interested in actually having to check out of the millions of people that have been tested, how many of those have actually recovered from COVID-19. And it is very good for me to actually highlight that at the moment, we're sitting at about 1,513,202 cases that have recovered. And that puts us at about 95% of the recovery rate from COVID-19, which is not very, very bad for our country. Dr. Mandela?
Yes, thank you very much. I think then when you look at our recoveries, we are sitting at above, basically above about 90%, which is very good for the country, and also remembering that we are a lower middle income country, and with the issues of which actually translates to the issues and resources that a country like ours would have. But as we know, I think South Africa is one of the low middle income countries that are actually really pushing above their weight, because we have done very well in some instances, and especially in the healthcare sector. We know that we have one of the busiest airports in Africa, if not the highest, busiest airport. That is our Tambo, which then makes South Africa to be very vulnerable with the issues of globalization in the background. That we are very active, and a lot of SADC countries also, they use our airport as the gateway to Africa. So we have similar issues that actually makes South Africa to be also vulnerable, and we know that we have other groups of countries that we form part of, for instance, in the BRICS countries, and you also need to look at how we are doing within the BRICS, and as well as in the African Union, in our own our continent. So basically, when in terms of that, Dr. Gumede, I think we can then maybe just tackle some few issues that we think our viewers have, or maybe want to maybe clarify.
Yeah, so we do have some questions that have come up from our people, but obviously I think that it is important for all of us to actually have a look at where we come from. I mean, I think from the first case of COVID-19, I think we didn't believe it, because this started somewhere in China, in Wuhan, when we first had the case of COVID, and to come up to 2021, nobody actually thought that in 2021, in May, we would be talking about COVID-19 again, and we really didn't plan for anything that has come. Many things have changed, obviously, because of all the regulations that have been put in trying to make sure that this infection is actually contained. And I do believe that, after everything that has been done, the government has done so well in terms of getting the public to be aware of this infection. But obviously, there are always questions, and all of that, people are not very clear. Remember, this is a new infection, right? And people have never experienced anything like this. So even the researchers and people that deal with research around the area of infectious diseases are also learning through the process. So, the information that they are also sharing is the information that many people do not even understand, and they are questioning quite a lot of things about it. So, what we did then was to actually ask the public to give us a few sort of like questions, if they are uncertain about issues and stuff like that. And I'd like us just to go through that. Question one from Umboneni Ndlovu on Facebook, actually questioned, and he says that most of the people are actually questioning how come Department of Health knows or how to predict the spread of COVID-19. You know that we've had people sort of like, speculating in terms of, oh, we're going to have a second wave, we're going to have a third wave, and this is how much the numbers are going to look like and all of those type of things. So really the question is here, how do we know that, how the behavior of COVID-19 is going to be in the next few, and how do we know that there's going to be a second wave? How do we know that there's going to be a third wave? Do you have any view of that, Dr. Mandela?
Yeah, thank you very much. I think it's Mboneni. I think what he needs to understand maybe is that we every time when there is a prediction of something, there are models that are sophisticated, used by researchers to actually predict how things will go, and also the issue of testing within our institutions as well. These things are reported almost each and every day, and there is data that moves from institutions to district level, and then it moves to the province, then it moves to the National Department of Health. There is that process that goes on there, which then feeds any changes that will happen, as we just did here, Dr. Gumede, that we are actually presenting the statistics as from the Department of Health at national level of the numbers of how they look like. Yes, there's numbers that might actually a little bit delay. That is why we always have to report numbers of the previous day. But there are some other issues that might happen that might make the number not to be exact, but these are the numbers that are very reliable in terms of the system that we are using. Maybe what we can say also, Tumboneni, would be that there are cases that you might find that they are not linked to healthcare institutions, that where you can say researchers have also very complicated derivatives that they use to make sure that these numbers that are not within the healthcare system and counted as health count or whatever is that is from the healthcare institutions might also be added in some ways, or plus or minus, just to give a number that is not very far from the real numbers that we see. And there will be issues like, for instance, what we call R numbers that will actually predict of what the infection has a potential of actually 1% has a potential of infecting how many people and all that. So these numbers are done and they are calculated very well, so you can trust that those numbers are very reliable in terms of giving the picture of the country. And basically, it's not only in South Africa. I mean, basically in the whole research world, that is how it's done.
Yeah, thank you very much. I think that it's very important for our listeners and for everybody to understand that there's actually a lot of work that goes on in the background when it comes to COVID-19 and how decisions are being made and how the predictions are actually being made. And there are people who are working day and night to try and understand the complexity of the disease itself and how it progresses and who it affects more than others. And the more we get people infected and the behavior is more understood, the better we actually get to know exactly what is actually going on. But there's still a lot of work that needs to be done. And we do hope that, as we go on and understand more and more precise information is going to go out. But we'll remember that we had actually somewhere back in the long time ago in the 1800s and stuff like that, we had something that actually happened, I think if it was not in the 1900s, I can't remember when, with the Spanish flu, Dr. Mandela. We know the behavior of the Spanish flu. We saw when you look at the graph of the Spanish flu, the first wave was a little bit smaller, but the second wave hit very hard and it was very high because I think at that time people had sort of like relaxed their ways of living, and they had relaxed their preventative measures that they had put in place, and then it hit very hard. Whereas the third wave actually didn't show that much increase in it. And those are also some of the lessons that are actually used to predict how this thing is going to move. And obviously, we are the world that is interconnected. We are connected with one another. So something that is happening in China or the United States, it's easily within a matter of like 2 days or even less than a day, a person in South Africa can be affected by it. So we're living in one big whole world that is very connected. So we need to understand what is going on in the other parts of the world. Now, the other question that Umboneni actually came up with was the issue of how would you encourage an ordinary person who refused to be vaccinated to actually get vaccinated? Is there, I mean, there's been a lot of issues around people actually saying that, no, don't get yourself vaccinated because they are going to trace all your steps and all of those type of things. I mean, what is going on here? How can we change the views of the people when we also know very well, Dr. Mandela, that actually it is the right of a person to either accept or refuse to be vaccinated? Nobody is actually forced to vaccinate. But how would you motivate people around that area?
I think, Dr. Gumede, I think for us that became doctors at during the time where social media also forms part of basically of information. Normally, this information used to be accessed from magazines and all those things and newspapers. But now, I mean, it's very quick. It's on your phone. You have been sent by somebody else and all that. So information moves very, very quick. So the information that is basically, which is okay to be skeptical about certain things, but it needs to be based on evidence and also science. As much as it does make its own mistakes, but science is the processes of science, of how you get to conclusions in terms of science, is a well-established and well-oiled machine, and then how people get to the finality of the answers that they are looking for, because it's a process that involves research. It's a process that involves a lot of ethics that are involved there in order to come up with these conclusions and directions in terms of, in our case, in terms of COVID-19. So there are those issues that people need to, and I think also the level, not necessarily academic, but the level of education and the information at the level of the community is also very, very, very important, because you then you then discuss with people or with the population things that are already known in the population in terms of the base. That is, the basics must be known, so that when you add information in that base, at least you find a fertile ground. So we have that challenge in South Africa of information at the level of the public, because our also primary healthcare strategy and re-engineering has not bear fruits yet in terms of the population information at that level. So we're therefore going to struggle when we come up, when the pandemics come like this, because when you start telling people certain things, people start to be skeptical, and we've got other people that have access to these social medias, which then take over and communicate to the public on behalf of government or whatever. But basically, a vaccine is something that has always been there. Kids get vaccinated, children get vaccinated against TB, against different types of pneumonias, against rubella, against all these things, measles and all that. So people get vaccinated, kids get vaccinated. And this is the very same token. And I know there is that school of people that says, hey, vaccines are bad and all that. Because of globalization, I think vaccines, they become actually very relevant for survival of humanity as a whole. So vaccinating is far better than actually getting a surprise of a particular disease, and you don't know if your body will be able to fight it. And so it's a proactive way of doing this, and it's evidence based, fortunately enough.
Yeah, definitely. I mean, it's very interesting, Dr. Mandela, that you actually highlight the fact that vaccines have always been there, and it's something that we've been using. I mean, I do have some of the marks in my body that actually proves that I've been vaccinated even when I was a kid, and probably, I mean, we've seen over the years that the statistics of these preventable infections, how much they've decreased over time, and I don't think that it's anything different to what is actually happening now. Vaccination forms part of the fundamental intervention of public health in terms of prevention that we actually need to stipulate on, and it forms part of the other aspect of preventative measures that needs to be put in place to make sure that people don't get infected. And if they do get infected, they actually don't have the severe disease. And when they don't have the severe disease, it means that they won't need an admission to a hospital, for instance. Therefore, it becomes very, very important for our people to actually understand that vaccination is actually very important for us. And if at all we can get 40 million people in this country vaccinated, then we can achieve our herd immunity. And I mean, everybody is allowed to be skeptical, and people are saying that vaccines can have side effects and adverse events and all of that, just like any other medication can actually have. It's not only a vaccination that is a COVID-19 vaccine that actually can cause any side effects or adverse events, but we haven't actually proved especially in South Africa, with the data that we have, vaccines that have caused major problems. So it is very important to actually get people to understand the value and the importance of vaccination. Now, Dr. Mandela, there is a question from Madlamini Umakosi. She's asking a question. Is it true that people who were infected during the second wave are actually immune to COVID-19 infection?
Yeah, okay. Yeah, I think Umakosi is asking a very relevant question. The immunity, obviously, there is some kind of, what we say in medicine, some kind of immunity that you will develop after you have contracted a Sanele disease and your body got to know about it and it developed some antibodies against that particular disease. Yes, you do. But the issue is that because of also in research that has not got us into the right space in terms of how long will that immunity last is a biggest problem. Yeah. So the one that you just get that is from that infection, how long will that immunity last becomes an issue. So vaccine is therefore very important, because at least in research we know that it will give you 6 months, it will give you 8 months, it will give you, depending on the issues. Then that is why it is therefore important that you can have that immunity that can develop within that particular week or so, or 2 months or whatever. But it's always going to be important that even if you have gotten that immunity, you still have to go and vaccine. But that is very important thing that I think here, Dr. Gumede, we need to share, because as we are doctors, is that the issue of people developing immunity from having contracted the virus. It's also important to think that the virus is mutating every day, and there are lots of variants that come in every day, which might also fail you when you think that you have gotten a virus in January. Now you won't be getting sick again in February or in March. It is very important that those things are understood, because you might have been infected earlier by another variant, and then you are reinfected by another variant at a later stage, which will then therefore cause a problem in terms of actually getting the infection. So it is very important. So vaccines are important, and research is coming now every day about how long each and every vaccine that we get will last, and we hope to keep us safe, and also maybe not even to get you sick in such a way that you actually have to go to the hospital just to get just the normal flu that you would get. And we always do, especially myself, I always, every time when there's winter is supposed to start, I do get my flu vaccine, because I work in that environment of interacting with a lot of people in the hospital and seeing patients, and it always will work for me when I do that. Normally, you will get a flu that will take you about 5 days or so, and maybe sometimes it will actually even keep you in bed. But when you have that flu vaccine that you have gotten before that the winter starts or whatever, you normally will get just a mild flu symptoms one day, or sometimes not even get anything 1 day or 2 days, but that will not even keep you away from work. So those are some of the things that I think are very important in terms of this science that we are talking about today, issue of vaccinating and COVID-19 infection as well.
Yeah, so thank you very much, Dr. Mandela. I think that it's very clear that as the time goes, we're actually going to understand this virus better and better, and that actually vaccine doesn't substitute, your preventative strategies that you still have to take at home. Those are things like wearing your mask. Those are things like washing your hands with either water and soap or a sanitizer. Those are things like social distancing and not really accessing areas where there's going to be a large group of people that you're going to be interacting with. I think it's always better to have sessions like this where you have Zoom platforms and the meetings and stuff like that to make sure that we minimize our contact with other people who might have the disease. And in that way, we are able to control the spread of this COVID-19. So vaccine in itself is not really a substitute for somebody to wear a mask or to continue using the actually preventative measures in place. Is that correct, Dr. Mandela?
Yes, for now, I think that is what is out there, that we need to continue to make sure that we wear mask and we social distance. And when you have touched somewhere or we are moving from one area to the next, make sure that those hands are sanitized by an alcohol agent that is about 70% alcohol. And we make sure that we keep it even in our cars, we keep it everywhere we go. And you have your small, and now it's very nice. You buy these small things that are very portable, that you can carry even in your pocket when you move to a shop, and maybe you don't see that where maybe it's placed in that particular shop, then you can actually use yours. And while you are still inside the shop shopping, you might need to use yours, and because when you're touching and you're moving some issues that you are moving in the shelves, and you might actually use your hands, or maybe taking something back that you realize that you don't need to be buying it. So all those things you need to make sure that is done. And another thing that is important is to actually test if you feel or you have symptoms, and you have this sore throat, or you've got flu symptoms, or if you're coughing, or you feel that you're getting hot or something, you make sure that you, in this case, in these days now, things have increased, and we now talk about even diarrhea and all those other things, so that you need to test for, and make sure that you go and do that PCR, and you test for COVID-19. Now, in our institutions, we have even a rapid test that can be done as quickly as possible, and you are able to test if you're COVID positive or not, and then you will then manage it that way. But the issue of crowding in small areas is still a very high risk, and we need to make sure that we do that. If you can, always have a meeting or sit outside, and you social distance, and you have your good chat, and instead of sitting in the house that is with no ventilation, with very poor ventilation, and to stay there, because the infection is very rough in those settings where there is close, actually there is no ventilation. It becomes a real challenge.
Yeah, thank you very much, Dr. Mandela. I think that it's important. Let me just jump in, because we're talking about these vaccines and stuff like that. And I think Nkosinathi Cegwana had actually asked a question around about the issue that we've actually just discussed. And he says that we now know that COVID-19 mutates and forms a new strain from time to time. I think you've alluded to this. That's why we're talking about the issues that are happening in India. And South Africa started identifying their own strain from a long time ago. And then there was a strain from Brazil or from the UK and so on. So he asked a question here. He says, we also now know that available vaccines protect us only against the already known strains of COVID-19. This being said, is it necessary to vaccinate? I think that you've already alluded to say that it doesn't change the fact. I mean, even if there are changes with the vaccine, still the vaccine will actually help you either to make your infection less severe or even prevent the infection at all. So it is actually very important for that. But where I want us to go to is actually where he says, if so, will the herd immunity be ever achieved, since it looks like the new strains becoming more and more transmissible and more likely to cause death?
Yeah, fortunately, herd immunity will be reached by a certain percentage of the population that will be vaccinated. But and also, this is important. Also here to note, Dr. Gumede, for our viewers, that even the very same variants that comes up, they come up because of people not being vaccinated, because it would then let the virus try to survive in many ways that it finds it fit for itself to be able to survive, to change its structure, to make sure that it's more infectious, or in order for it to keep to maintain its life, and it does all these things that it does in order to keep itself alive. So these are things that are just natural process of any living being that will modify its environment. Like human beings, we modify our environment. We do everything that we can do to make sure that we modify our environment. Some of the times we to our own detrimental, but we normally would have to do that. So as viruses also have that responsibility to themselves to survive and make sure that it changes and it gets stronger and all that. So those are some of the things that are important. But it is important to note that herd immunity is also reached by the population that is being vaccinated, and we're happy that in South Africa the things are moving, and we are getting these vaccines. And it's very sad to look at not only South Africa, because when you look at the statistics, Dr. Gumede, is that almost 83% of the population in these high income countries, that is UK, Europe, and United North America as well, that is Canada, United States, they have vaccinated their people, and they have very high numbers, even people that have gotten the first dose. But when you look at the third world countries, you will see that the vaccination is less than 0.5%, which is worrying, which tells you that even the regulations, the conclusions, and the policy change in terms of WHO, of how even the rights of formulas of vaccine or creating vaccines are now said to be not to be a problem for the whole of the world, are very progressive policies that actually look at everyone needs to have access, irrespective of how much money we have. And then those are some of the things that are very, very important, and of which they have very much advocated. And South Africa and India was leading in that discussion. And we are happy that even United States have come on board to say, no, this is what we need to be doing going forward. And then it was announced by Biden administration as well. So these are very important issues in terms of having access to vaccines.
Yeah, thank you. I think it is important for us to actually also just explain the terminology herd immunity for our viewers and our listeners, to say that for us, for South Africa, a population of more than 55 million people, to achieve herd immunity, we need to vaccinate at least about 40 million people in this country. And so if we are still skeptical about vaccines, I wonder when we're going to get there. So it is very important that we get jacked up, we actually come to the party and understand that for us, for all of us, it's in the interest of the country to actually get us back to normal so that our economy can proceed. So it is important that we actually take our part, go register for vaccination and actually vaccinate. talking about registration, I just want to highlight a few things around. I think it would be a shame if I don't actually cover this on this talk today. So let me just cover it now, because I think it is actually very, very important. Now, if you want to vaccinate, myself, I've already been vaccinated, and it's easy if you've got it. And Dr. Mandela here is already vaccinated. I know that my wife, Lynn, is, outside there, and she's also vaccinated. But if you do want to get vaccinated and you are a healthcare worker, or you are a community member who is above the age of 60, and you've got comorbidities and above the age of 40 and all of that, there is a website that you need to go to if you have a smartphone or a tablet, and that website is vaccine.enroll.health.gov.za. It is right here on top. I've put it right here for a reason, so that you won't forget about it. It has been here from the word go. I started, and then I put it here so that you can actually have it in the public, so that you can go through this. But most importantly, now we actually know again that now you can use other ways of registration. And I think this is a very exciting news. And if I can actually make this slide just a little bit bigger, so that maybe you guys can actually see this. I'm going to try and just get it just a little bit bigger and close my face a little bit there, or maybe not close my face, but just make it a little bit bigger and put it maybe down somewhere, so that you can see the numbers that I'm actually, I'm just going to make myself a little bit, I'm going to make myself a little bit smaller, so that I'll be able to move around. Okay, it's fine. So there is a website. I'm sure that you can actually see this now. It's actually bigger than what it was. So now that you can register by WhatsApp, by the way, so you send the name register to 0600123456, or you can just use your phone and dial *134*832*. Then you put your full 13-digit identity number, then you put a hash at the end, and then it will go, and then you get registered. Or if you don't have the ID number for whatever reason, you can always dial *134*832#. And it is very, very important for all of us to note that these are actually zero rated, which means that you don't need data to actually send this or the airtime. You just need to be, your data needs to be on for the website. And also you just need to just send this information so that you can be registered for vaccination. So I thought it was important for all of us just to note this information, because it was important to say, let us all take charge of our lives and the lives of our communities. Therefore, let's get vaccinated. Dr. Mandela?
Excellent stuff. Excellent stuff. Dr. Gums. Excellent stuff. So this is the number that people need to use to register. As he has already said, register to 06001234556, and then you can also dial that #134 *134*832* and your 13 identity number, and you put a hash there. So this is very important that we do this, ladies and gentlemen, and our viewers out there. All right.
Okay, I'm just going to keep it right here for everybody to see, and while we continue with our talk. So we're just about the end of our talk. We've got maybe just 2 questions that are still pending to answer, and then we just wrap it up. So Utapelo Moloti here says, South Africa battles with a quadruple burden of diseases, and many of these diseases are preventable, and as such, some are lifestyle related. Looking at our primordial model of preventing the rapid spread of COVID-19, what lessons do you have for a post-pandemic era in combating our other many preventable diseses? This is a very good question, Dr. Mandela.
That's a very good question. Actually, for a person who has studied in Cuba, who championed primary healthcare and approach in terms of preventative medicine and promotion of health, it's basically an excellent question. So no, I think South Africa needs to we need to change the way we've been doing things in the past. and really invest in that area, of which we have already started. I mean, we got back from Cuba, me and Dr. Gumede and the other colleagues that we started with in that island. We started working in areas that we never thought we would work when we left for our training. And I was based in Pomeroy, and Dr. Gumede was based in Polela. And these are strategic areas when you look at in terms of access to healthcare at that very basic level in poor communities, that they must have access to healthcare. And again, the strategy here is also to say, make sure that that community is informed about their own issues, and they are well educated about their own diseases and the comorbidities that they live with. So basically here, this question says, it's asking some, like, that is this change in strategy in terms of approach. And I will even go further and say, I think one of the things that I think we have seen over the years, and also even internationally, is actually making sure that when we have communities at our level, we need to make sure that the people that lead these institutions, or the people that lead, that is primary care centers, which are our clinics, the community health centers, which are that is our CHCs, people that lead these institutions, I think it is important that at least one should have a diploma in public health.
Yeah.
I say this, I know it might be very controversial, but I tell you, this will help South Africa, because things that are of health will be, or policies or strategies will be built from the ground, and it will inform the people at the district level, people at the provincial level, and the people at national level. Yeah. So it will be that mass action that is done from bottom up. And you will have people that actually understand and champion how you deal with the communities at that level. And we know that our training has always been, in South Africa, has always been orientated to the European kind of training, specifically of England. Yeah. And that has also dealt with similar issues the way these issues were dealt with before apartheid was banned. So right now, what we're trying to champion, I think what government tries to champion, is actually having access to clinics. That is excellent. That is the starting point. But you go further than that and say, make sure that that community that uses that clinic understand how to use that clinic. Because, I mean, going there just as a head count, and going there because you are sick, because you are, I wish one day South Africa has a clinic, but also a clinic is functioning as a source of information of where our clients or our healthcare users will go there to gain information, to understand something that they don't understand. Like right now, if they want more information about COVID, they will go to the clinic and get information about COVID, not only to go there just to pick up medication and all that. So I wish that day comes in South Africa where we use our healthcare facilities not only to get medication, and because of whatever reasons that we're getting that medication for, but also to get information and to be educated and understand about our health and understand about your own condition that you have, because you will have a person who is them. So that strategy needs to be championed by people who are aware of how you need to work in the community. And we are doing that right now. We have OTLs, that is outreach team leaders, that are leading these WBOT teams. And this is the start of a very massive paradigm shift in terms of healthcare system and approach in South Africa. And also to respect this level of care, because that is where it actually benefits Albert Lutuli, it benefits Steve Biko, it benefits Tykerbeck, it benefits Roteskir, because you would have had a base that is very, very good. And you know that when you send a patient to Albert Lutuli or Grace Hospital or whatever, you know that you're sending a patient that has already in its population, in its catchment population, that clinic has already classified it very, very well. And we know preventative measures and interventions that are done at that particular level. Unfortunately, it's a big question that needs a whole lot of discussion. I think that we need to look at Dr. Gumede so that we can also call some of our experts to come and explain these issues on how healthcare systems work.
Yeah, that's very important. I think that we do need to actually revisit the issue of the strategies that are meant to actually take care of the non-communicable diseases, which are actually, very problematic. But also we've got HIV, we've got TB, we've got many others that we still need to take care of. And it is actually, this question actually also is a question that you could ask when it comes to how we've actually forgotten about NCDs when we concentrated more on TB and HIV. And that's exactly what actually happened. And I think that we don't have to repeat the same mistakes. We can actually learn from all the things that happened during the HIV treatment. We actually learn about all the things that are happening now with COVID-19, and then take all of those and actually contribute, make them as a contribution to how then are we going to develop a very strategic approach towards the quadruple burden of diseases, and to emphasize on the prevention that is much better than the cure is, and much more expensive. And just before, Dr. Mandela, I know that we're just about to get into the end of our time. We've got only about 10 minutes to go to 1:15, and we started at 9:15. But before the last question, I just want us to entertain some of the comments that are on Facebook at the moment. And I think that Gumede is actually, again, is consistent in our shows. And he actually saying that the biggest issue right now is why traveling to and from India is not banned. I mean, look at what is happening there. It's definitely a different variant that is knocking them down, and it's getting here, of which I think it has, and it will fuel the third wave situation. So, I mean, I know that, I'm tempted to actually give sort of like a very diplomatic answer to Ulonda when it comes to a situation. Why not ban the traveling and stuff like that? But what I can actually say about that is that the Minister of Health is actually in consultation with a team of specialists that are looking into this to come up with interventions to control the situation that is happening in the other countries. And I think that he's doing a great job in doing so. Consultation is necessary. They cannot just take a unilateral decision. Therefore, they need to look at evidence-based information that they have for them to be able to actually, say that, okay, then this is the situation that we are going to take. But it is very important to also note that he did come out to the media to say that actually people in this country, we are not accepting, or there are no straight flights from India straight to South Africa and from South Africa to India. So we know that that is actually happening. And we know about something that happened on the sea somewhere where people have been, diagnosed with COVID-19, and one of which I think found they got very sick and they are actually admitted and in a hospital somewhere. But I think that let's give space for the Ministry of Health to look into this and to come up with a better solution already that they are doing, and to make sure that the population of South Africa is actually safe.
No, I think you said a mouthful there. It's a very complicated thing. Unfortunately, we live in the global community, and we normally have difficulties in terms of coming to conclusions of these matters. But I'm sure our minister is dealing with that, and I'm sure we'll get some announcement soon, I'm sure. Right. If we can look at our last question and let's see.
Yeah, so the last question here, actually, Dr. Lindy Westmelan is actually asking a question here. So she says, that the loss of critical skills from the pandemic is quite significant, especially in health system. So while many have passed on, a significant number is actually bearing a brunt of a post-COVID syndrome that affects their functionality in the workspace. Is the Department of Health prepared to deal with this gap that will affect the system in various ways?
That's an excellent question from Dr. Sanele. I think unfortunately, we're not answering on behalf of government, but we're just engaging on issues of health, as we have mentioned in our show. That I think what she's highlighting is that we know that some of our colleagues, even in the private sector, because you can only talk about the public sector only, but even in the private sector, some of our colleagues in the private sector, as others, they've basically changed the way they do things, basically even leaving the profession, some of them. I saw an interview from CNN, an anesthetist is no longer going to work because he was afraid to leave his young kids and his wife, and he started to do something else, and that is very scary. The impact that it has made to the profession of ours that is so noble. I think I'm hoping that these gaps that are also created by the pandemic are also looked at. I know that government sometimes, is an elephant. It takes long to turn and to the other direction and all that. But I think there are processes in place to make sure that we basically, first of all, maybe replace some of the colleagues that have left, on some of the colleagues that have perished during this pandemic, and may their soul rest in peace. And also to make sure that we have proactive ways going forward in terms of dealing with these types of problems and the pandemic. And unfortunately, a pandemic it always gives these challenges, because it's not only a South African problem that we can tackle. Like, look at how well we have done with HIV in terms of rolling out treatment, because it was our issue, and we had different ways of how we wanted to tackle it. And at one stage, we're a country that had the biggest problem of HIV, and with our life expectancy as well being smashed there. But now we have seen some improvement just because we implemented the strategies that we have implemented. This is a problem for us, I think, Dr. Gumede. It doesn't have only one answer, but it needs South Africa to champion what they've already spoken about the issue of NHI, the issue of universal health coverage, which will also talk to these issues, and therefore put more resources specifically in the primary healthcare sector, because that is the backbone of any healthcare system. If that healthcare system needs to thrive, is to make sure that we, as poor people can be, but access to healthcare people need to have. Otherwise, if they don't have access to healthcare, I mean, you will always having patients being referred to Grace or being referred to Albert Luthuli because they've got the stage 4 advanced cervical CA, stage 4 advanced lung cancer, stage 4 advanced, whatever. We will always have those issues. But if we can have these resources put at that primary care level, that means we will have very huge campaigns about the detrimental consequences of smoking, the issues of the diet that we are now getting used to. We eat fast foods everywhere, every corner. There are fast foods. So these are issues that we can actually focus on and make very huge campaigns that are based at the primary care level. And you will then see the difference, because otherwise, even Albert Luthuli will be overwhelmed, even Grace will be overwhelmed if we all have to send those patients there, because we will have every patient that comes across with a primary healthcare setting. You will always see that this patient doesn't belong here. We need to move this patient. If the patient doesn't belong here, you have to move this patient. So that is the crux of the matter. But it is a big question. And again, it needs its own show. The question that Dr. Masmelane is putting forward.
Yeah,
and I don't know what's your take, Doc.
No, you know what I think is that I think what we will need is to actually assess our situation. Perhaps maybe start it just before COVID-19 goes away to look at how exactly, our workforce has been affected by this. This will give us, so we need to do what we call the root cause analysis to look at the effects of COVID-19 in the workforce that we have in health. In that way, that will give us an opportunity to actually start now putting measures in place that will counteract that impact, because we cannot run away from the fact that we need to come up with better strategies to deal with these issues. Obviously, that will need a lot of consultation, stakeholder involvement to look at where the budget is going to come from, if we need more budget and things like that, or even a different way of doing things. And one way of actually doing things is to decrease the number of people that access our regional tertiary facilities, to actually focus on making sure that our primary health care is actually well packaged, that our primary health care is actually beefed up in a way that it will prevent a large majority of the patients from actually going upper, meaning that we are able to control the disease before it gets worse, so that we can ensure that we are able to deal with these issues. Otherwise, if we don't change and move with the flow, make sure that we intensify our strides to make sure that NHI is actually in place and working, and get better strategies to do so, I don't see us getting out of this. But obviously, I think that the experts and people that are actually advising the minister and everybody else are going to make a very serious look into this, and to come up with better strategies to solve the problems that will arise after COVID. So just to end a little bit with a few, maybe about 2 comments that I have. I'm getting more and more comments from Facebook. I think there was a question about these 2 questions. I think Dr. Pagamani Mteto is actually saying that my understanding is that vaccines protect against the severe disease, which subsequently translates to less transmission than herd immunity. I think this is correct, Dr. Mandela. Your mic is actually off, Dr. Mandela.
Sorry about that. Yeah, exactly, Dr. Paramani. Actually, that's exactly what it does. You need to vaccinate people, and as we know that even Johnson & Johnson, in some of its preliminary results, showed that the severe disease which might lead to death can be avoided here. So people need to vaccinate. Unfortunately, it has to be done. And yes, everyone's got the right to decide not to. But if we all want to be going back to the stadiums, watching our favorite soccer teams, or our favorite rugby teams, or cricket, or whatever, I think this is the way to go. And I've seen in the US already, they have opened some few places now, Broadway shows, and they are getting opened because people they are now showing that they've been vaccinated, and they can go ahead and enjoy life as we were enjoying before this pandemic.
Yeah. No, thank you very much, Dr. Mandela. I think we've come to the end of our show, but before again we actually close, I want to remind our viewers and our listeners about the fact that if you want to get vaccinated, you still need to register. You're not going to get a vaccine without being registered in the system. Therefore, it's important. Just here above, I've put in a website that is vaccine.enroll.health.gov.za, where you can register on your smartphone and also on your tablet or on your computer if it has the net. This is a 0-rated website that you can go in. Your data also needs to be on, but it's not going to use it because it's 0-rated. But now we also have new ways of registering. So you can also send a message and write the name register to a WhatsApp number, and that number is 0600123456, or else you can dial *134*832 your ID number, 13 digits, then you press a hash at the end. If you don't have an ID number, you just dial *134 *832 hash. So Mandela, we've come to the end of our show. Any last words before we close?
No, I think we'll say thank you very much for our listeners and the people that are following us on Facebook. And thank you very much for the support and the questions that are coming through. And we are hoping each and every week we will better our show and make sure that we keep you guys informed. And thank you very much, Dr. Gumede.
All right. Thank you very much, Dr. Mandela. Safe for me to say that today is the 8th of May, 2021. And again, today is my birthday. So this is a very good way of actually interacting with the public on my
let's go have a cake.
Birthday. It's always like that. So thank you very much. We want to appreciate the questions that were sent to us on a Facebook platform, but we also do appreciate the interaction on Facebook during our show. And we're getting a lot of feedback and people are really excited about the information that we are sharing. They are actually informing us about the new topics that we need to actually cover in the future. Dr. Mandela, thank you very much for always forming part of these shows. Again, this is Dr. Nhlakanipho Gumede Talks Health and Healthcare Systems. We say bye-bye for now.